I think the program is particularly unique because of the multi-talented faculty to start with. Internal medicine, infectious disease, emergency medicine, surgery, general internal medicine.
Hospice and palliative medicine in itself is a team-based field or specialty. I couldn't do the work that I do without the rest of my team.
This is a really great team to learn to do that with, or to hone those skills with, because they are people who I think inside and out absolutely respect each other and really take time to truly work as a team.
We're very fortunate that we have a dedicated music therapist that works on our program every day. We have 3 chaplains that rotate and work on our program and are very involved in daily care. And we have our own dedicated social worker.
This is a place that will push you out of your comfort zone, but you will always have the support of a team to fall back on.
In pediatrics, we have kind of a classic cliche phrase, and that is, kids aren't just little adults. And I think that's really true.
So in the 1-year Hospice and Palliative Medicine Fellowship, there's 1 month dedicated to peds, or a 4-week block.
I think wherever you work, whether you're in a hospital setting, whether you're in a community setting, whether you go out and you practice your primary specialty, you're going to be dealing with kids, whether that is an actual pediatric patient, whether that is the child of one of the patients that you are taking care of, or the grandchild.
This is an opportunity for them to get exposure to a variety of ages, everything from the neonatal intensive care unit and even perinatal care interviews to teenagers who are transitioning from pediatric medicine specialists to adult medicine specialists.
We work with our fellows, whether they are really interested in doing a lot of pediatrics in their future, or whether they are just taking a little detour.
So if you're interested in more pediatrics, we can certainly help you have that experience as part of our program.
We've started a PGY2 residency for pharmacists focusing on palliative care and pain management. And we have a model where the pharmacy resident is embedded in the fellowship program. They share an office with the fellows. They have clinic together on the same day. And we try to overlap their other rotations as well to maximize their time together.
Myself as a pharmacist, I helped with pharmacology concepts with my fellows while they helped me build my ability with physical assessments and really taking things out of pharmacy.
But it's also very reassuring knowing that there are people that are on your team, in your corner, who have such in-depth understanding of the things that you take for granted.
And they become really good friends. And that just is one of the things that we hope that would happen as our interprofessional faculty.
You know, I will say that Iowa City Hospice is a phenomenal place to work. I have a very complicated schedule. I do a lot of different things. I wear a bunch of different hats, but that is one piece of my schedule that I just will not give up, in part or in large part because of the people I get to work with.
The fellows get to maintain this relationship with 3 to 4 patients on a rolling basis. So as the fellow comes on and has their 4-week rotation, they get assigned patients that come onto the Iowa City Hospice program.
The staff there are absolutely phenomenal. They are completely and totally committed to providing great patient care and to providing education and teaching sort of the next generation.
I consider the fellows' experience at Iowa City Hospice much like learning a language by immersion. The fellow over the year will go from being an observer to a full participant and a leader in the interdisciplinary team process. It's a very fun growth experience to watch.
I think fellows here are going to have an excellent preparation in humanistic medicine. As a palliative care doctor, I think that is vital, and they will get to experience not only what is evidence-based, but also what is the art of medicine.
I think it's a really accepting environment. And I keep coming back here because I just believe in this institution. I think it's an outstanding, highly committed place.
Everyone has just been incredibly welcoming and personable, and so you feel comfortable right from the moment you arrive.
Hi, I want to thank you for your interest in our Hospice and Palliative Medicine Fellowship at the University of Iowa. From my perspective, I think we are especially unique in the experience you can receive for education and scholarship. You'll have the opportunity to work with multiple faculty with specialized training in medical education as well as research. We invite you to learn more about our program from our website. Please feel free to reach out to us directly with any questions about our program.